Reprise the débat. The honourable member for Vancouver Centre.
Mr. Speaker, I think that one of the things that my colleague from Vancouver East was just saying is that this particular piece of legislation far oversteps what the Supreme Court of Canada ruled. The Supreme Court of Canada gave 5 very clear factors that the government must look at if they are ever to approve another safe consumption site in any particular place that applies, for one. It's not imposing it on anyone. It's in any place that applies for safe consumption site. That's the first thing. But what we feel and what many witnesses had said, Mr. Speaker, was that this so oversteps that it intrudes into provincial jurisdiction, into municipal jurisdiction, into the jurisdiction of the local police forces, into the public health officer of that region's work, and into whatever the public health officer is doing based on criteria set by the College of Physicians and Surgeons. So what we see is here is a government that at one point continues, whenever you ask them a question about health, they continue to say, don't talk to us about it, it's a provincial jurisdiction to deliver services. And all of a sudden, this government posts 26 very specific pieces on their legislation, factors that is going to intrude so much on the jurisdictions of other levels of government and other police forces and on physicians that it is unbelievable. Mr. Speaker, let me tell you something. The Supreme Court of Canada ruled that a government's the right to life, liberty and security of the person under Section 7 of the Charter actually overshadows any decision on the Canadian Food and Drug Act. And that was what it was noted, because, Mr. Speaker, I was there. I was, in fact, the designated minister to look after this when we were in government. And what we found was that everything, when Vancouver, downtown East Side, during the Vancouver Agreement, asked for this safe consumption site to be done, it was put forward by the province. It was put forward by the mayor of the city. The police agreed to have a bubble zone only in that particular area where people could use an illicit substance. So everything was taken into consideration. But, Mr. Speaker, let me give you some facts. Prior to the safe injection site being put up in Vancouver, there were about 234 overdose deaths. And I mean deaths, Mr. Speaker. People died from overdose in the prior 2 years per year. 234. After the safe injection site was set up in 2010, there were 2,395 overdoses, and not a single one of them resulted in death, which is why the Supreme Court of Canada said that this showed that this safe injection site actually saved lives. Now, Mr. Speaker, when I listen to what is said around here, I know that this particular government seems to think that somebody who is using substances and who is going to die is probably disposable. Obviously, these are human beings. These are Canadians. And their lives are worthwhile. And as a physician, I can tell you that every single life is worthwhile when we look after our patients. So for people to stand here in this House, Mr. Speaker, and talk about the fact that this is not wanted in their particular region, as my member, the member from Vancouver East said, nobody's inflicting or imposing anything on anybody's town or village or city. But when you have a situation in which 234 people are dying from overdose deaths, when the rates of HIV and hepatitis C in that little place called Vancouver East was up to extraordinary amounts, and when following this, we have seen that, in fact, there were 2,100 new cases of HIV prior to the setting up of this safe injection site in Vancouver, and today there are 30. Mr. Speaker, 2,100 to 30. It means that this form of harm reduction works. Now, the idea of the 26 pieces pieces in the legislation that this government brought forward is so intrusive that it's going to make it absolutely impossible for any city to ask for a safe injection site, for any police to okay it, for any public health officer to give the details and the data of why it's needed, and from every province who wishes one to be able to say so. We brought in amendments between the New Democratic Party and the Liberal Party. There were 60 amendments brought into this particular bill, C2. Mr. Speaker, not one comma was changed. Not one comma. And this is what happens in most parliamentary committees right now under this particular government. No one listens. We pay extraordinary amounts of money for people to come as witnesses. They are expert witnesses. They come to present to Parliament. We listen. So much for consultation. We listen to what they suggest. And when the majority suggests particular amendments, this government just says no. This government runs a parliamentary committee which is made up of parliamentarians from all parties and is not an arm of the government. It is an institution of Parliament and therefore should be completely non-partisan in terms of what it delivers. It should listen to experts. It should factor in what they say. That's what consultation is about, Mr. Speaker. Not about listening to a whole bunch of people and then telling them, thank you very much, but I don't think I care what you said. I don't like it and I'm not going to do it. The ideology of this government that opposes harm reduction is a word that has been expunged from every single piece of language that this government brings about. They don't like the idea of harm reduction. Mr. Speaker, I will tell you that as a physician, the word harm reduction means that when someone is suffering from a disease that has the ability to threaten their lives, harm reduction is an intervention that brings down the harm so that the person doesn't die as a result of that particular illness, but is able to continue on until a cure is found or some other ability to help them to live properly is found. And we've seen exactly this under the safe consumption site in Vancouver. Mr. Speaker, in Australia, in Europe, in Spain, in Portugal, there are safe consumption sites. It is a result of what they did in Europe that we decided to do this particular pilot project in Vancouver. And it showed itself, evidence-based is a word that is thrown around by this government. Evidence-based means when you do something, what are the outcomes? What does the evidence show you? What is the rate of mortality? What is the rate of morbidity? What is the harm done? How is that harm alleviated? And that's what evidence-based means. And it is very clear that the safe injection site in Vancouver showed this. Now, Mr. Speaker, the fact that this government has put up all of these barriers means that there is never going to be another safe injection site in this country. And in fact, the one in Vancouver has been extended for a year, and I see that as some really obvious ploy to wait until this bill passes, so that then again the government can stop the safe injection site in Vancouver from even existing. And this is, Mr. Speaker, these are people's lives. It is really, for me as a physician, it's untenable that a government would stand in the way of saving lives. And, Mr. Speaker, what is also untenable is that when this bill was tabled by the Minister of Health in the House, within an hour, a letter went through from the Conservative Party of Canada to all of its members and donors saying, we just put forward a bill that's going to stop junkies from shooting up in your neighbourhood. Mr. Speaker, this is extraordinary coming from a government. This is absolutely disgusting as far as I'm concerned, that people's lives should be so meaningless to this government that they would send out such an absolutely callous letter asking for money. So, Mr. Speaker, all I have to say is simply this. The word consultation is a joke. Parliamentary committees are a joke currently under this government. People can come and say whatever they like. They never listen. So when I suggest that, and when we hear other people saying that this bill is brought back exactly as it went to committee with not even a comma changed, I think, Mr. Speaker, that tells you the state of Parliament at the moment in this country. It is no longer a democracy. Thank you.
Questions and comments. Question commentaire. The Honourable Parliamentary Secretary to the Prime Minister.
Thank you very much, Mr. Speaker. Mr. Speaker, it's very difficult to listen to a Liberal talk about, consulting and listening to Canadians, Mr. Speaker. She talks about the fact that we want consultation in this bill, and she says we don't actually care about people. Because our opinions might be different than hers, we don't care about people, Mr. Speaker. So by that measure, her government, the government that she was a member of, which cut $50 billion in health care, certainly really didn't care about Canadians, Mr. Speaker, because they did it unilaterally, Mr. Speaker. As the Minister of State talks also about hepatitis C, I guess they really didn't care about Canadians then, Mr. Speaker. This from a member who won her election in her riding by what, 33, 34%? Mr. Speaker, I don't know, so 70%, 67% of the people in her riding don't agree with her, Mr. Speaker. Mr. Speaker, the reality is this. The reality is this. This bill gives people the opportunity to have a say, Mr. Speaker. It gives them the opportunity to have a say. The real reason that they don't approve of that is because they know that Canadians won't always agree with their position, Mr. Speaker. And that's the real reason why they're having trouble supporting this bill, Mr. Speaker. So I don't even need an answer from the member, Mr. Speaker. It's more of a comment. It's more of a comment, Mr. Speaker. It's more of a comment that the Liberals never have, never will, ever respect what Canadians have to say, Mr. Speaker. And that's why increasingly election after election after election, they get reduced from opposition to third-party status, Mr. Speaker, and I'm sure after the next election, Canadians will put them out in the lobby and in the dust.
The honourable member for Vancouver Centre.
Mr. Speaker, thank goodness I won't fall for that kind of ridiculous answer from the parliamentary secretary. We are talking about evidence-based decision-making. And, Mr. Speaker, evidence does not depend on the member's opinion or his subjective attitude to things, or on the government's opinion or the government's subjective attitude to anything. It depends on outcomes. It depends on what happens when you do something and what the evidence shows comes as a result of it. So evidence is clearly showing that, Mr. Speaker, I would like to be able to answer the question and have the member stop heckling. He had his say, and he was very personal about what he had to say. But, Mr. Speaker, evidence-based decision-making is something that has nothing to do with opinions, it has nothing to do with subjectivity, and this government continues to make decisions based on subjectivity. They ignore evidence, they ignore expert advice, and I could list how many times this government has done that. But, Mr. Speaker, I don't have the time. Thank you.
Questions and comments? Question est commentaire. L'honorable député de...
The honourable member for La Pointe de l'Île.
I think it's very rich coming from the parliamentary secretary because, to my knowledge, only 40% of the Canadians that went to vote voted for the Conservatives. So that means that 60% didn't vote for them. So I don't think he can talk about a majority there because it has nothing to do with the percentage of people that voted for someone or for a government. We're talking about saving lives. And my question to the member is, so let's see this from a perspective of public safety, because we all know how the government likes to brag about being hard on crime and they want to protect communities. But for a community that has a problematic of these kinds of situations, how is this going to help make their communities safer by having those kinds of injection sites? Thank you very much, Mr. Speaker.
The honourable member for Vancouver Centre, you have about 50 seconds.
Thank you very much, Mr. Speaker. I thank the member for her question. And I think, Mr. Speaker, the important thing, again, about any kind of public policy is evidence. This has shown, not only in Europe, but in Australia and in Vancouver East, that, in fact, this safe injection site saved lives. The ability to save lives when you know that in fact, all of these people who live, Mr. Speaker, may not be important to this government, mainly because they're intravenous drug users, mainly because they suffer from HIV and hepatitis C, and this government doesn't seem to care about certain people in this country. It's evident from all of the decisions that they make. But the point is it saves lives, and it actually, every HIV case that is not that is allowed to drop in HIV cases. Each case of HIV costs this government $500,000 a year per patient. So it not only saves lives, Mr. Speaker, it saves money.